My name is Alicia Cisne, and I am a nursing practitioner student at Maryville University, and this is my heart and lung assessment on Becky. So with every assessment, the first thing you're going to do is inspect them while you're talking to them. You're going to make sure while they're talking they're not short of breath, they're not dyspneic at all, that you're going to note their color, that they're pink, warm, and dry. Make sure that there's not any pallor or cyanosis. While you're talking, you can check a cap refill real quick, make sure it's less than 3 seconds. That just gives you a good idea of how good their circulation is. You're also going to check for the trachea, make sure it's midline, making sure that their respirations are even and unlabored, that it's symmetrical on both sides. You can also go to the back and check for symmetrical chest rise and fall. So with this, I'm going to have you take a deep breath in and then let it out. So then you're going to place your thumbs in the middle of their back and then take a deep breath in again, Becky. So you want to make sure your hands are symmetrical out and see how far out that they go. You're going to come back to the front and you're going to check for any crepitus, any subcutaneous emphysema, any abnormalities like that. A good way to do an assessment is actually to have their shirt off. Women to wear like a sports bra, or men just to be completely shirtless. And then you're also going to check for tactile firmness. With this, I want you to say 99.
99.
And again.
99.
And this is a really good way to see if there's any like abnormal vibrations.
99. 99.
Making sure that it's symmetrical
99.
on both sides is really important.
99.
It checks for
99.
consolidation in the lung forms.
99.
Good. Then we're going to go back to the front and we're going to listen to all the lung fields. Best to listen with your diaphragm. Just deep breaths in and out. You want to make sure that the lungs are clear. You're not hearing any crackles, any wheezes, bronchi. And if you do notice any of that, just make note of where it's at. Always listen to the front and the back and go to the lateral sides also. Lateral really gives you a good idea of the right and left bases. And hers are clear. While you've got your stethoscope on the back, have them go ahead and say 99 again.
99. 99. 99. 99.
And this is called
99.
bronchoscopy. This
99.
checks for any consolidation. If you do notice any anywhere, it's a good thing to notice to see if there's any fluid in the lungs or any pneumonia that could be building up. The next thing you do is you palpate in the intercostal spaces. Should be a resonant sound if the lungs are normal and clear. You want to note if there's any hyper resonancy or hypo, like a dull sound. If you were to go over the ribs, it will be dull. So you want to make sure you get in between the ribs. Then while you're still doing that, so what I want you to do this time, Becky, is take a deep breath in and let it out. And you're going to check for the lung base when you do this. Okay. And then if you had a pen, you could mark it, you know, if you're really wanting to check the diaphragm excursion. So then on this one, I want you to take a deep breath in for me. You can kind of just start about the area that you were before and mark your way down. Should be about 3 centimeters between the two of those to see where the diaphragmatic excursion is. The next thing you're going to do is listen to the heart. You're going to listen first on the second intercostal space on the right side. And then you're going to go to the left. And that's atria and pulmonic. You're going to be listening for S1, S2. Then you're going to go 3rd, 4th, and 5th intercostal space, which is your Earth's point. And then 5th on the side, this is where you check the mitral valve the best. You're going to make sure you listen with your bell and your diaphragm, making note if there's any S3s, S4s, any murmurs, revs, clicks, any abnormalities. If you do hear any of those, try to check and see which part of the heart cycle it's in. A good way to note that is to either check radial or carotid pulse at the same time, so you can see if it's with the S1 or S2. While she's sitting here, I'm going to have you lean forward a little bit. This is the best way to check the atrial areas. Brings the heart a little closer to the chest wall so you can hear it better. Okay. Then I'm going to have you lay down and we're going to do this line. The 3 areas that you want you want to do sitting up, you want to do supine, and then you also want to do a left lateral. Always check in right and left, second intercostal space, in the 3rd, 4th, and 5th on the left side, and then 5th lateral. Again with the bell and the diaphragm. And I'll have you go left lateral now. And I don't notice any murmurs, clicks, or rubs, or any abnormal heart sounds. It's a good S1, S2, love dub. While you have the patient supine, it's also good to check the jugular vein distension here. You'll just notice where the jugular vein comes in from the subclavicular notch. And then you want to feel for a carotid pulse in that area. You want to make sure only to feel a carotid pulse on one side at a time and not to go on the upper portion below the neck, because that's where the nerves innervate and you can make the patient vagal if you palpate there. Sit up. And that's it. Thank you.